Hello, this is Dr. Richard Chen, and in today's short talk, I'm going to introduce to you briefly the concepts of low carb, ketogenic, and a keto carnivore diet. And here's my introduction. I'm not going to read it. And we all know that the diseases have root causes and processes which eventually lead to clinical presentations. And we need to intervene at the root cause level in order to cure any diseases. And diet is one of these root causes. And as for the other root causes and the processes, we're not going to discuss in this section. And this is the whole scope of anti-aging functional medicine. And briefly, let's discuss the types of fats in our body. And we generally speaking have about 4 types of fats. First is the structural fat, the fat that makes up our body part. For example, brain. You know, people say you have a fat brain. Yes, you do have a fat brain. You have a lot of fat in the brain. You have about 20% in the brain that's fat, and our cell membrane that's all fat. And so those are the structural fat is not for energy, is not for storage. They serve a structural purpose. Then we have the subcutaneous fat. That's the fat under your skin. And that, of course, that insulates, that keeps you warm, and that also stores energy. And that is important energy storage area where, because when you eat, the fat goes in there, and when you don't eat, when you're hungry, the fat comes out of the under the skin fat storage. That's normal. Then the bad part is the third part is the visceral fat. We all know that's the fat you don't want. It's around your belly, your waist, and around your thigh. And that's the part that is associated and may cause diseases. And of course, we all have some brown fat, which is not very significant in amounts, but that helps to, brown fat mostly helps to burn, to create heat. Now, we all know the old Hippocratic saying is let food be thy medicine and medicine be thy food. Our ancestors, tens of thousands of years ago, even older, before agriculture appeared, were hunters and gatherers, and they thrived mostly on animal foods. Okay, because there was not much. It's hard to find these wild crops and these carbs. Okay, the animal fat was critical for our human brain to develop, and about 10 to 12,000 years ago, when agriculture started showing up, humans began to settle down, and they began to eat more grains and carbs. That's how it's been changing. And in the last century, a couple of decades ago, agricultural chemicals, pesticides, and all these chemicals, some good, some not so good, and later the GMO, the gene transfer products, started showing up in our diet, which has been correlated with a lot of the health issues we have. And about last about 50, 60 years ago, the public was told that fat was bad because of the association with heart disease, and the people started turning to sugar and carb for energy, because what you can eat, you have only fat, carb, protein, as energy. And so if you don't eat fat, obviously you turn to sugar. And so the metabolic diseases, particularly the obesity, the diabetes, heart diseases, and many others, haven't been really declining. Instead, many of these diseases continue to climb, as we know. For example, the obesity, diabetes continue to be a prominent public health threat in the United States. Now, to me, today it's a brief lecture. I'm not gonna go into detail, but here is the spectrum of diets I consider as healthy. On the left hand is the low carb diet, and then a little bit more strict low carb is the ketogenic diet, and then a extreme version of ketogenic diet is the keto carnivore diet. But what is low carb diet? Basically, any carbohydrate intake that's less than what you normally eat is low carb for you. Okay. Of course, academically they have all these definitions, but one of the common definitions is probably if you eat less than 150 grams of carbohydrates a day, that's roughly about 25-26% of your daily total calorie intake, of course, for average. And so that's the low carb. A low carb diet, basically you reduce the carbohydrate intake, and still the carbohydrate energy is sufficient, and you may or may not burn fat as calorie as energy in this kind of diet. Now, ketogenic diet is a stricter form of low carb, meaning even lower. Basically, the carbohydrate content is usually less than 50 grams in a day. And there are several types of ketogenic diet, the so-called nutritional ketosis or a therapeutic ketosis. And in general, your body will, basically the classic ketogenic diet is that 80% of your calorie intake is from fat, and that's the classic definition. And the hallmark of ketogenic diet is, ketogenic. Keto means ketone body. Ketone body is the final breakdown product of fat, and ketone bodies then enter the cellular mitochondria, which is the battery, and that's where the ketone bodies will be metabolized to produce energy in the form of ATP mostly. So ketogenic diet is a fat burning diet. Okay, of course, the fat can be from the food or can be from your body, but that's the hallmark of a ketogenic diet. In one of the slides I will discuss, will show you. It's very simply, how do you know if you have entered ketogenic diet? Simply, you can measure your ketone bodies. And the easy way to do is at home. It's just a urine dipstick. It's very inexpensive, very simple. If it's positive, you're producing ketone. It's that simple. Then on the bottom of this list is the keto carnivore diet. Carnivore diet we know is basically animal foods. Okay. Now, animals have, we call it a red meat or white meat, and basically lean meats and fatty meat. And carnivore diet tends to be high in protein. And when the protein load is too high, it may give an extra burden to our liver and our kidneys. So keto carnivore diet, basically it adds a restriction that the protein intake in your carnivore diet will be restricted. And protein is generally recommended to be around 1 to 1.2 grams per kilogram of body weight. Now, this way, of course, what makes up from the carnivore diet is the fat for the loss of the energy. And so why is that important? It is important in certain conditions. Now, of course, on the carnivore diet, you practically eat very little or no animal-based food. Now, low carb diet. So low carb diet, I recommend the low carb ketogenic diet for all people. Okay, depends on conditions. We may use strictly, more or less strictly, on people with certain diseases, or And we recommend low carb ketogenic for a couple of reasons. And here is the list of what I think are the important reasons. Now, on the website, most people have been discussing primarily of low carb and ketogenic diet for the management of diabetes, weight loss, and metabolic diseases. So basically, the concern is the energy. However, I think it's more than just energy. Now, for the first reason, obviously, is about the energy. Is that I recommend a low carb ketogenic diet to all people, primarily to restore energy, restore fat as our natural energy source for our body, because our human body is built to burn fat as the natural source of energy, not carbohydrates, not proteins. carbohydrates and proteins are not meant to be our main energy sources. And when this the importance of energy source is disturbed, many problems ensue. For example, why do we for example, we know we store our body doesn't store protein. All our proteins are in the muscles. Okay, so we don't have like a protein pad here or there. We don't store protein, extra protein for energy. So proteins are meant to be structural parts for our body. Do we store sugar? Yes, we do a little bit. And we store some sugar in the liver. We call it glycogen. And we also store some in the muscles, as you know. But we don't store a whole lot. The estimated capacity is about 500 grams, okay, which is about 2,000 calories worth of carbohydrates. And that's all the storing capacity in our body. 2,000 calories is not much. It's one day's energy source, okay? So if you go on fasting, if you don't eat anything, within a day, you'll burn off all those carbohydrates in the body. So how can carbohydrate be the main source of energy if we don't store a whole lot? In contrast, if you look at our body, particularly people with a little bit, too much fat, practically it seems like we have unlimited storage space for fat. And I'm sure we all read on the website, on the internet, that some people can be as heavy as like 1,000 pounds or even heavier. Personally, in my clinic here in the United States, I've seen patients greater than 600 pounds. So clearly, our body has unlimited way or capacity of storing, nearly unlimited, not exactly, to a certain degree, of storing energy, fat. Okay, so that's and also in one of the first few slides we described that our ancestors had been primarily eating animal foods and fats as our food. So I believe, and many people like me believe, that fat actually is the natural source, the key natural source for our body. And so now we need to restore that, because when we restore that, a lot of health problems will go away or will improve. Now that's that. So this applies to practically everybody, whether you have metabolic disease or not. And here I want to add a little bit more. Think about it. I always say, when we put on a jacket, leather shoes and suit, we begin to forget that we're animals. We are all animals, albeit we are intelligent animals. Now, how many animals in the wilderness you have seen? They eat 3 meals a day, and right. So actually, I'm not going into detail. We are carnivores. We human beings are carnivores, and there are lots of evidence to support that. I'm not going to go into detail today. So anyway, in a nutshell, that fat is our natural key energy. Okay, in another somewhere else we will describe that. Now, second main reason for low carb ketogenic is for people with metabolic disease, and that's the key. That's what most people talk about, primarily because it's simply diabetic patients. The hallmark of diabetes is the elevation or the rise of blood sugar. So simply, if you eat less sugar, you will improve the problem. So that's what the most low carb ketogenic diet is for. Of course, not just diabetes, but also cholesterol problems and high blood pressure and atherosclerosis, cardiovascular diseases, and these other diseases. Okay, and then finally, also, there's another major reason that I listed here, is that for people with suspected unhealthy gut, in other words, in layman, we call it the leaky gut or dysbiosis, basically the disturbance of normal healthy environment in the gut. Okay, now this actually is critical, and some other time we'll talk about this, is that it is actually an important process. It's not necessarily the root cause here, okay? It leads to a lot of problems, particularly in people with autoimmune diseases. For example, IBD, inflammatory bowel disease, is part of this, and the thyroid problems, or skin diseases, or lupus, or actually, if you check all those autoimmune diseases, anywhere you check, you will see there's there's this leaky gut where research is available. Okay, so I particularly apply keto carnivore diet to these people. Why? Because I believe, and a lot of people like me believe, that the leaky gut or unhealthy gut is one of the key root causes for those diseases. Now, how do you eat low carb diet? It's pretty simple. Just cut down on your carb intake. Okay. The key here is that you need to pay attention to it. Okay. So you need anything, you need to take dedication. Now, here it's important part is you have to take the ownership of your own health and disease. Okay. Unlike in the past, you do whatever you want and you get sick, you see a doctor, and you expect a pill or a knife, cutting a surgery, then the disease will go away. No, that's old school. We got to change that. Okay. You need to take the ownership. I'm the coach. The doctors are your coach, and you are the athlete. We'll teach you, we'll give you all the supply equipment, but you got to practice. If you don't practice, you'll never win a championship. If you don't take the ownership, you will never regain full health. Okay. So basically cut down your carbohydrates, and in particular, don't eat refined sugar. You shouldn't, cut as much as possible depending on your health situation. And cut down on your rice or wheat products, potatoes, corns, processed foods. All these crackers, biscuits, all these things, they add, high corn syrup, and it's very sugar, very sweet. Okay. So you need to learn some nutrition knowledge. You need to learn how to read the label. So that's pretty simple. It's not that hard. Now, ketogenic diet, it's a little bit more advanced. As I explained in the previous slide, ketogenic diet means keto means ketone bodies, genic means producing. So in a way, it's very simple. It's called a ketone body producing diet. And I already mentioned, when you produce ketone bodies in the blood, and it will go into the urine. And if you do a dip stick into the urine, you will see it's very, very expensive, very cheap. Okay. Of course, you can always go fancier. You can go to the hospital for a blood ketone measurement, or you can buy a ketone, measurement device at home. Some people do. Okay. Now, so ketogenic diet is usually used for people with diabetes. And actually here I want to add a little bit more. As I mentioned earlier, if you restore, let me go back a little bit here. So one of the key problems today for people is that, now typically, let's say, for example, take a diabetic patient, obese diabetic patient as an example. Obese diabetic patient has a lot of fat stored in the body, as we all know. However, many of these diabetic patients, when they miss a meal, they may show hypoglycemic symptoms. They may faint, they may feel tired, and basically they show lack of energy. Why? Have you ever stopped and thought to think, why do these obese diabetic patients, when they have so much energy packed in the body, but when they need it, they can't release and they can't have energy? Why? Here's the why. It's because their body doesn't know how to release their stored energy, how to utilize the energy more. So that's the energy mechanism problem. And when I ask my patients, myself included, go to ketogenic diet, like I said, is we are trying to restore your mechanisms, your body's ways of using fat as natural energy. So no matter how skinny you are, today we all have plenty of fat in our body. So if your body is able to efficiently, smoothly release fat and burn into, metabolize into energy and burn it, you will never develop hypoglycemic or low energy symptoms. And this is pretty important. Why is that? Because like I mentioned, in the wilderness, you don't see animals eating 3 meals a day. You see animals feast on a hunt and on a harvest, and I may go on days without food. And I have I've done myself. Okay, for the past 5-6 years, I've been on low carb ketogenic diet. Why? Because I play badminton. And today I can miss a meal and I play 2 hours straight badminton against people half my age without feeling hungry, without having hypoglycemic symptoms. Why? Because I have trained my body to better utilize my fat. Okay, this is important for everybody, for healthy people too. Okay, particularly for if you have diabetic or metabolic disease, that's particularly important. Okay, so that's the main reason I advise everybody to try this. Okay, now I might add here for healthy people, what you want to do is you want to train your body, basically go on ketogenic diet, maybe for a couple of weeks to 3 months in a row. Be pretty strict. Why is that? Because I don't know your health situation. I do not, your energy releasing, fat releasing mechanism may be impaired to different degrees. So you need to allow certain time to readjust because our bodies have uh, 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 our bodies have different on different stage of problem and healthy problems. So so you need to get used to release and burn fat for energy. Once that this is called ketosis. Once you are in a ketosis state, then you are able to do that. Then you can relax, eat a little bit carbohydrates for fun, for enjoyment, and that's okay for normal people. Okay. Now there's also strict, a special form of ketogenic diet. Usually we call it the restricted ketogenic diet, but we only reserve it for cancer treatment. Again, that's for another topic. We're not going to go into that today. Now, how to practice keto carnivore diet? As I explained in the previous slide, is that carnivore diet means you eat only animal-based foods. Okay, the concept here is that because the plant foods have certain level of toxicities. Okay, and again, I am not going to discuss in detail today, but all plant foods have toxic chemicals in them, not only the contaminated chemicals, but also the natural chemicals, because all plants have, for their defense, chemicals that are toxic to animals or to small insects and to our human beings, okay, to varying degree. So, uh, so that's one of the reasons, because some of those plants may be harming our gut health for some people and contributing to the autoimmune diseases we discussed earlier. And that's the key reason why I advise carnivore diet for some people, particularly for those people, as I mentioned, with hard to treat diseases. So autoimmune diseases, if I try my conventional low carb ketogenic diet doesn't really help work, then I may go on a little bit more strict, and that's how we usually use it. At this stage, we may not be practical and may not be necessary to go on full-blown carnivore diet for most people. But here again, I want to also stress the keto part. When you eat a carnivore diet, basically carnivore diet just means you eat animal foods. But animal foods, you have lean meats and fatty meats. Okay, when you eat too much lean meat, because that contains a lot of protein. When you have too much protein, you may cause extra burden to your liver and your kidneys, and we don't want that. And also, too much protein can be converted into sugar. Okay, so in a way, that's that's not a low carb diet anymore, particularly for cancer patients. So we don't want more than unnecessary sugar, protein, because in cancer metabolic treatment, we want to limit and restrict the carbohydrate, the sugar. And when you eat too much protein, the protein will be converted to sugar through a process called gluconeogenesis. So these are the spectrum of diets that I recommend. And here are a few examples, and I meant this talk to be short. This is for weight loss, like this lady here. She lost more than half of her body weight. She was 310 pounds. She lost 176 pounds in little more than a year, about 30 months. Okay, on the low carb diet. And this is another. Well, here's showing a picture. These are two buddies, badminton friends, and the one that looks nice. Not only playing badminton, but also restricts his diet. But the one on the left with belly, that he drinks, he drinks and eats, and So that's what the point here is, that exercise is important. I advise everybody to do it. But if you think you can lose weight on exercise, forget it. Now here, this is one book called The Carnivore Code by Paul Saladino, a friend of mine, and which talks about the carnivore diet, which I really think is a great book. Everybody should read. Here's our Chinese edition, published in Chinese on Amazon and in China. And here is another a few cases here. A Dawn, this is a middle-aged lady, Caucasian lady here in South Carolina. And a couple of years ago, when I saw, she came in with 6 months history of skin rashes, you can see here, as along with abdominal complaints, basically discomfort and diarrhea. And she's seen multiple doctors, CT, biopsy, and with to no avail. But anyway, she presented to our clinic, and within 10 minutes of her listening to her, I already know what's going on. In essence, I put her on uh, actually I put her on carnivore diet, strict ketogenic diet, okay, because I don't know what's going on in her diet. And so within 6 weeks, actually on the left side here, 4 weeks here, on the low carb, ketogenic, keto carnivore diet, her skin improved dramatically. And on the right side, you can see 2 months later when I came back to the United States, and she completely healed. She was very happy. And of course, other than that, we also use some others. Antioxidants are a vitamin C and antioxidants, and also some detox, because these patients usually have a lot of toxic chemicals in their body. And this is a low carb diet for vitiligo. As you can see, this is a friend of mine, over 40 years of friendship. And you can see clearly vitiligo improved within 1 year span on low carb diet. And here some other friend. This is another. Uh, this is, as you can see here, father and son. Okay, in northern part of China, and they suffered for quite a while. This is going back quite a few years ago now. The father is a sailor. He's a second. He's a second man on a ocean liner, and he couldn't work for quite a while. And he was very happy. Uh, as you can see here, skin cleared up on the ketogenic diet and the vitamin C, liver detox, and our total cell nutrition package, which contains a lot of antioxidants. Now, this is my badminton friend in Shanghai, also one of my medical school alumni. He has psoriasis, as you can see here. And these are very smart people, and they don't always trust whatever you tell them. But this is good friend of mine, completely convert. Actually, believe it or not, he owns a drug company, and he hates drugs now. Okay, and as you can see, he improved. And this is Dr. Seafried, Tom Seafried, professor of biology at Boston College. He summarized very nicely in this cancer as a metabolic disease, which we also translated and published in China here. And in essence, cancer is a disease of energy. Here is energy again. Now, I'm not going to go into detail, but basically, by limiting, I'm sure everybody here listening to me has heard about starving the cancer to death. Basically, that theory comes from here, is that we have cancer is a disease of energy metabolism problem, and the cancer cells cannot metabolize fat to produce energy. So cancer cells primarily rely on glucose, sugar. So by limiting the carbohydrates and forcing the body to burn fat, and we can help patients to improve, and along with others. Of course, we put this cancer metabolic theory in the context of integrative cancer therapy, and we target other areas as I listed on the second slide of this talk that look at the total body. This is a cancer patient, 90 years old now. He came to us 2-3 years ago. He was at the end stage of cancer, but he's now back good. And this is a cancer patient from Hong Kong, the same thing for 5 years now, almost dying, and we put her on the cancer metabolic therapy. She's a lot of tumor nodules has disappeared, and she's improved much better. And here is lastly, here's a patient from Norway, Osmond. 10 years ago now, he had a large cell lymphoma in the chest, and with this therapy, about 2-3 years ago, he became cancer free. Thank you very much, everybody.